Hello and welcome to Med4care. I am Dr. Care and today's topic is medical history. In medicine, the diagnosis of a disease is a three-stage process. The first of these is called anamnesis. The word anamnesis derives from the ancient Greek anamnesis, and originally meant memory, intended as an evocation of a past experience or knowledge. In medicine, this word has taken on the meaning of careful and detailed collection of information regarding the patient's state of health. Indeed, the first stage of a diagnostic process always involves the reconstruction of the patient's clinical history. Medical history generally consists of a thorough and extensive personal interview between doctor and patient. For convenience, we divide it into family, physiological, and pathological medical history. The latter further articulated in remote and proximate. During the family history, the clinical history of the patient's relatives is taken into consideration. Generally, the doctor focuses on the causes of death, on the pathologies and hereditary diseases that have marked their clinical histories. In the physiological anamnesis, however, the doctor collects information on the patient's habits, for example about his place of residence, diet, type of work done, or quality of sleep. Finally, there is the pathological anamnesis divided into remote and proximate. The remote pathological history investigates all the patient's previous diseases, while the proximate pathological history consists of a careful investigation of the current disorder. What it is, in which region of the body it is located, when it arose and how it occurred. Medical history takes time, energy, dialogue and mutual interest to orient the doctor in the right direction. Indeed, it's essential to create a good level of collaboration between the doctor and the patient. Certainly, the more accurate the information the patient reports, the higher the chances of an accurate diagnosis. Obviously, doctors listening during the anamnesis is anything but passive. On the contrary, during the interview the doctor critically analyzes the information reported by the patient, re-elaborates it and directs his questions with consequences. A particular case of anamnesis is that of the unconscious patient, for example in the case of a newborn or a subject suffering from serious psychiatric pathologies. In these cases, the so-called heteroanamnesis takes place. The doctor's questions are answered by the patient's closest and most reliable family member. In conclusion, we can underline how the anamnesis is a delicate and complex moment. Its success can direct the diagnostic suspicion in a precise direction to be confirmed later in the following diagnostic process. We are now at the end of today's video. We hope you enjoyed it. If you found it useful, please support us with a nice like and subscribe to the channel. See you soon on Med4care.